welcome Gary Wild to the podium.
Mike, thank you very much. I'm going to cover a number of topics tonight that start with the Affordable Care Act. There'll be a lot of questions toward the end, I'm sure, about that and other topics. I'm going to turn the podium over to Stan Froschwag. Dr. Froschwag is going to talk about some of the medical advancements in our health system, and then I'll conclude with some updates about how we're doing financially, about the projects here in Ventura and also in Ojai. But let me start with the progress of what we're doing with the Affordable Care Act. It is now in place. It's here. We presented in these series a two-part series on the Affordable Care Act, and they're still online. We partnered with professors at UCLA and did two one-hour programs. And anybody who's particularly interested in the Affordable Care Act, I think we covered a lot of detail. The intent tonight is not to go through that, but just to hit on a couple of highlights of what the status is and the impact nationally in the state, patient impact, and also provider impact. And let me start with the state and national impact. First of all, we now have, as of today actually, an estimated 8 million people throughout the United States that have signed up through the healthcare exchange. About 1.4 million Californians signed up. 88% of those nationwide, and that statistic is about the same in California, qualify for the tax subsidy. I'll talk about that in a moment. But then the actual number of how many additional came up, have been insured is still being processed. And the reason is about 1/3 of all those who went through the exchange already had insurance. About 85% have paid their premiums. And we're also pleased that about 29% are age 18 through 35, the so-called invincibles. In addition to that number, the Medicaid expansion, we've had an increase of about 3 million people who have qualified for Medicaid. In California, we call it Medi-Cal, and about 1.5 million, or half of the nation's total, have come from the state of California. So what is the impact? This cost curve shows the United States and other countries that we compare ourselves with, Switzerland, Germany, Canada, and so forth, and you can see that the United States continues to spend more money in healthcare per capita than anyone else. We spend almost $9,000 per person in the United States, and the closest one is about $6,000, and that's Switzerland. The others are fewer. Now, the impact of the Affordable Care Act is this will cost us more money than it did before. And the estimates have ranged from about $1 trillion increase over a 10-year period. The Congressional Budget Office now estimates it's going to be closer to about $2.6 trillion over that 10-year. And the challenge for us, and the reason this is important, is that the United States borrows 46 cents out of every dollar that it spends. And healthcare is a large portion of that. So will the cost estimates be achieved? If not, how will we respond to avoid pressure on the federal deficit? And again, this topic tonight is not to focus on that, but I'd be very happy to answer questions you might have. Now, the impact on patients. The good news is that we have had a huge number of patients receive insurance that could not afford it or did not have the desire to buy it before. And so now patients have a greater access to insurance than they did before if they do not receive their insurance through their employer or through the government. It is also a guaranteed issue, and that's a fancy way of saying that no insurance company can deny coverage for a pre-existing condition or for any other reason. And individuals and families have essentially two options. They can obtain insurance either through their employer or they can purchase it through the exchange. If they don't do either of those, then they must pay an annual fine, and they will be without insurance. Now, the mechanisms are shown in this diagram here. The way the exchange works, an individual or a small employer goes to a computer and enters information, their own personal demographic information about income and so forth, and then that will bring them to one of three screens. Individuals who are low income, right now that is approximately 200% or less of the federal poverty guideline, receive Medicaid insurance. Those that earn 400% or less than the federal poverty guideline must purchase insurance, but they receive a premium tax credit, either up front or when they file their income taxes the following year. Everybody else has to buy insurance. Approximately 88% of those that buy the insurance do receive some subsidy. Modest or large, it's a sliding scale subsidy, and about 88% receive that. Once that's determined, an individual then selects between a bronze, silver, gold, or platinum plan. The platinum plan has the highest premium, but it has the lowest copays and deductible. And the reverse is true, the corollary, that the bronze plan is the lowest premium, but it also has very high deductibles and high copays. There's actually a fifth choice of catastrophic only that many of the young invincibles obtain. Once that is done, then in our area, the Tri-County areas, San Luis Obispo, Santa Barbara, and Ventura counties, you can select among Kaiser Permanente, Anthem Blue Cross, or Blue Shield of California. Small employers can also choose HealthNet, and so one of these plans is selected, and then a certificate is given. Then you are registered as somebody and are not subject to the fine. You can also purchase insurance outside the exchange, but you need, it wouldn't be automatic that way that you are showing that you have insurance. Now, the way the tax credits work for individuals, individuals who have incomes of $15,000 as an individual or $31,180, they qualify for Medi-Cal and receive their insurance without any cost. Those individuals who have income of almost $46,000, or a family of $94,200, they qualify for these tax credits. And then above those numbers, then there is you're on your own. Now, for those who choose not to buy insurance or just fail to do so for whatever reason, there is a penalty, and it grows over time. The first year it's a minimum penalty of $95 for someone else, or 1% of their income. So somebody who has income of $30,000 would pay $300, $80,000 would pay $800, and that increases over time. In 2017, the minimum would be $700, and it would go up to that. The issue here for us is the estimated premium, not including the copays and the deductibles, is $3,800. And this is why some people have chosen to not purchase insurance, because the premium is actually higher than the penalty, but they do not have insurance. The other factor, and I believe that this is going to be coming to more of the discussion within the media, probably in the fall, is the fact that once the insurance is purchased, and I've chosen a silver plan here, there are very high deductibles and copays. An individual has to pay the first almost $3,000. This is an average plan. I didn't select Anthem or Kaiser or Blue Shield. This is just the average. An individual would have to pay the first $2,900, and a family would have to pay the first $6,000. A doctor visit would be $32, to a primary care physician, a specialist $56, and then you see the prices they would pay. The annual cap for an individual after the deductible is $5,700, and that's total, including the deductible. And for a family, it would be $11,500. The point here is individuals who believe that they are insured, and they are, have to pay a substantial portion of their care. And for a silver plan, it's anticipated that approximately on average 35% of the total cost of care would be out of pocket. And this is going to be a surprise to some individuals who believe that when they bought insurance, much like automobile insurance, there would be a much more generous payment to providers than there is. Now, the impact on providers, I'm going to go through and just say, and by the way, I'm not trying to cry on anybody's shoulder here, nor would physicians, but the result of this, reimbursements for most services have reduced and will continue to reduce over time. That is certainly true for hospitals. Narrow networks have been created. And what a narrow network is, it's a plan-specific provider panel. So certain numbers of physicians or hospitals are attached to a Kaiser plan or an Anthem plan or a Blue Shield plan. And a patient that signs up with one of those plans has a more narrow list of providers than perhaps before. And this can result in a loss or gain of patients to the providers. The provider must also collect those high deductibles that we mentioned and the copays. And so this often would put a strain between the patient and the provider. By the way, the law is you owe me this amount of money, and that's an awkward discussion to have, but this is going to be a surprise to some people. I'm now going to turn time over to Stan Frushwag. Stan is our Chief Medical Officer. He's invaluable for our community. He interfaces with the physicians on our staff and throughout. He has a particular interest in information technology and is going to share some exciting things with us. I invite Stan to the podium, please.
Well, thank you for inviting me this evening, and I really am looking forward to having this opportunity to bring you up to speed on what's going on at Community Memorial Health System. First of all, it's exciting for me to review this with you and talk about our health system, because we have an incredible team and community within our health system. We have over 2,000 employees working with us, and I have to say I have a regular opportunity to speak and work with physicians, hospital staff, nursing, and every component that really makes up the reason we're so successful in our community. But today I'm going to speak a little bit more specifically about physicians. I'm going to speak about the services and technology we have, the electronic health records, which is an area, as Gary had mentioned, which is of great interest to me, and as well as graduate medical education, because all these are actually very exciting components of medicine in the 21st century. I will tell you that our physicians are remarkable. And I don't just say that because these are my colleagues or the people with whom I work, but rather because the nature of Community Memorial and Ojai Valley is that we all know one another. We come from universities, and our hospital staff come from universities from around the country and around the world. We have the finest trained physicians anywhere, and we're always recognized from that by anybody who visits us. Our physicians are involved on a regular basis in teaching. As a matter of fact, many of these physicians continue to hold training and professorships positions in universities in Southern California and continue to do so. We have those who even go up to Stanford and continue to teach at Stanford. The collegiality and camaraderie of our physicians are also quite remarkable. The ability to share information for the benefit of our patients is really incomparable. We go to tumor board once a week. Gary often attends that to be updated and to just be part of the system. And physicians share the care of their patients at tumor board, where we review cancer cases freely and openly, always for the benefit of the patient. There's never discussion, well, how much is it going to cost me to get your opinion on this? That doesn't exist in medicine. It's one of the few professions left where we do all this for the benefit of the patients, for the benefits of our community. Finally, when I need a surgical consultation, or any physician needs a cardiology consultation or any other kind of consultation, be it a weekend, middle of the night, Christmas Eve, doesn't make a difference. We always have physicians available at a moment's notice. You'll notice that in some professions you can't get people that readily, but in our profession we're able to do that. Let me go back 2 slides. This is a family doctor. Many of you might know, Bill Spitel, and he is the consummate family doctor. He's with his patient here. He actually can be reviewing the patient's record on his phone. We have, and I'll go into that in more detail later. Bill is a primary care doctor. The majority of his time is spent in his office caring for patients on a one-to-one basis. But when they're hospitalized or needs hospitalization, he'll refer them to the hospital and also take care of them in the hospital. And he works with the hospitalists and the specialists in caring for the patient in an optimal fashion. We have many other specialists and services, and I'm going to go through some of our services, but allow me, because I can't go through all of them, to at least highlight the ones I'll not discuss this evening. We have advanced interventional cardiology. We have a emergency medicine program through our emergency room, which has the finest statistics in getting people from the door to the area that they need to be tended, be it in the cath lab or be it in the TPA being given for stroke remediation. We have a breast center of excellence. We have a bariatric center of excellence. We have a neurospine program that is with some of the finest and most advanced techniques. And we have a stroke program with a full-time neurologist available 24/7. And we're going to be getting a second stroke neurologist come August. Now, these are neurologists who do general neurology as well, but have a specialty training in stroke management, which for many years, you know, we put a great emphasis on preventing heart attacks and taking care of heart attacks when they occur. Well, we realize that we must do the same thing for stroke. Catch it early, and we can reverse the terrible side effects of having had a stroke. So we're going to increasingly note that to our community to bring their family in when this occurs in a much more prompt fashion. So let me first start with our open heart cardiac program, which has been at Community Memorial Hospital for the greater part of more than 30 years now. That's Dr. Lamar Bushnell on the left and Dr. Dominic Tedesco, who have been the stalwart rocks of our cardiac program. These two have some of the finest statistics in the region insofar as caring for patients and successful outcomes from cardiac surgery. And we do bypasses. We've done it for decades. We do mitral valve and other valvular heart disease care. These are two of our most respected and highly liked and valuable physicians. They work alongside our cardiologist. This is Tom Kong. Dr. Tom Kong is actually second generation. I first worked with his dad many years ago as one of our prominent and well-known cardiologists who worked with Dr. Hart to establish the cardiac care units at Community Memorial Hospital as well as Ventura County Medical Center. Dr. Kong is one of our leaders, and he has been instrumental in increasing the level of expertise and superb statistics and quality that we have now experienced in our cardiac care units. This is one of our younger physicians, Dr. Ishu Rao. Now, I have to tell you something. He's pointing at a screen on extremely advanced computer and technological systems that we brought in so that he could do the work that he needs to do. He works on people's electrical systems of the heart. He's a cardiologist, but all he does is manage the electrical system. So you hear about atrial fibrillation, you hear about all the different things that can be done to correct that. He does that. He can ablate or block out abnormal rhythms in the heart, put in pacemakers and implants of that nature, and he's remarkably good at it. One of my colleagues went to a few other centers around the state to get his cardiac arrhythmia taken care of. They couldn't help him, even though they were large universities. He came to our hospital, and Dr. Rao was able to set his heart correct and now no longer has that problem. These are also the same physicians who work in our vascular lab in our surgical procedures. We are the first and most successful robotic surgery program in Ventura County. In robotic surgery, the surgeon always operates the robot, but it gives him a meticulous and detailed ability to control the surgical field to the most minute degree. You can see enormous detail. I remember when these first came out, I couldn't understand why people wanted to work with them because they were hard to work through. But now this technology has become so crystal clear with high definition screens that it's really remarkable. As you can see here, we have men and women physicians who do this. Our areas of expertise allows us to make tiny incisions and allows our patients to go home sooner. This is in gynecologic surgery, urology, and general surgery principally. We also have our Comprehensive Cancer Resource Center, and on the left there you can see our rapid arc radiation machine that allows us, this is a remarkable machine, allows us to deliver radiation and kill tumors that are deep into the tissue, but allow the radiation to be concentrated in an area deep so that the skin and the superficial areas are not affected adversely. This is a remarkable technique that is really a godsend for us compared to what we had years ago. Our Coastal Communities Cancer Center involves radiation therapy, our Prostate Institute of America, the Breast Center, the oncologists that we have there, and we have gynecological oncology as well. So we have a wide array of services available, all in a single area, fully integrated. We also are very fortunate in the last few years to start a wound care center with hyperbaric. In certain conditions, wounds heal better. Not all wounds, but certain wounds do heal better in concentrated oxygen, higher atmosphere oxygen environment. And that's what this particular slide depicts. That's Dr. John Tessman, who is an expert and has practiced wound care for many years. Frankly, our community is incredibly thankful for his presence because quite frankly, wounds were not cared for as optimally as we would like to because there was no one who actually had a passion for caring for wounds. Dr. Tessman loves taking care of wounds. He heals them quickly and completely, and I have to tell you from personal experience with my own patients, I've been just delighted. The backbone and the bread and butter and the workhorses of our surgical team are our general surgeons, and I spoke to you about them briefly. This is Dr. Jim Woodburn, also multi-generational. He and his brother both practice general surgery in our community for decades now, and his dad was one of my mentors and trainers when I was back in residency training. Dr. James Woodburn Sr. And so I have to say, their presence and ready availability at any time really gives peace of mind to patients and their physician colleagues as well. Here we have a sample of our 128 low-dose CAT scanner. Now what this does is allows us to see images within the body that are so much more precise than we would have been able to see otherwise. We can pick up tumors and very small objects much earlier now, and we're starting to use these now for a new kind of discovery that we never did before, and that is catching lung cancer so early that we're now able to cure it. Now, in the past, lung cancer cure was very difficult and the odds were really against you. But now if you match the criteria or if you are so predisposed, we can pick up lung tumors at a curable stage. This is a remarkable and amazing accomplishment. I should mention our radiology services are widespread. We have radiology services along with our partner Grossman Imaging in Camarillo, in Oxnard as well as in Ventura. But we also have imaging capabilities in our Centers for Family Health as well, of which we have 13 primary care centers throughout Ventura County. Well, we are the leading maternal child health and birthing center in the county. We have to say that when we many years ago started natural birth, we were the first center to do it. It was really a remarkable experience at that time and continues to be the most sought after birthing center in the area. This is a picture of our intensive care nursery, or NICU, neonatal intensive care. And when you deliver babies, they don't always arrive on time. So we realize that if they arrive early, we need to take care of them. Our NICU is a level 3 NICU. It means that we can take care of very complicated problems. We can probably take care of just about anything short of cardiac surgery when children are born with abnormal hearts. Then we have to transfer those babies. And we occasionally see the helicopter land on top of the parking structure and take them down to UCLA or one of the other children's hospitals where they do that type of work. But this is part of the joy of what we get to participate in. But we don't just take care of the babies in-house, we also take care of them when they leave the hospital. And our New Parent Resource Center, this is depicting that, allows new mothers who sometimes, if it's their first baby, need a little help in figuring out how to breastfeed, how to be aware of what is normal and what isn't normal. For some of you veterans who've had a few children, you know, after the first one, you get to be pretty comfortable, but when it's your first one, that can be a very trying time. The Resource Center is available to all new parents and particularly graduates of our birthing center. Now, I'll have to tell you, these gentlemen, these are our intensivists. We have wonderful primary care doctors, but we have incredible specialists. These doctors started out in our town as pulmonary specialists, and then now they're double boarded in intensive care medicine. They are available, they rotate one a week usually, but they rotate through our intensive care unit, our cardiac care unit, and oversee all our patients. And they're available 24/7, spend most of their time there, extremely bright and very affable. Dr. Brugman and I graduated together. He's the second from the left. They're standing up. But they are a remarkable group, and we're very fortunate to have them. I want to emphasize something about our physicians. We not only work hard together, but we share, we're neighbors, we're friends, we play together. This is at one of our physician thank you receptions. And I'm very proud of this particular group because this is 3 generations of orthopedic surgeons. I'll give you an example. There, second from the right is Dr. John Hill, who has helped train me many years ago and now is retired from orthopedic surgery and is able to mentor others. Dr. Tom Golden Center is our chief of staff. On the far left is Dr. Fritz Menninger, really incredibly talented orthopedic surgeon who does most of the orthopedic surgery in Ojai Valley. He is tightly integrated with us, and we're grateful for that. The 2 gentlemen wearing the leis, those are our new resident orthopedic surgeons, and I'll talk to you a little bit more about that later. Here's another group of our physicians at another get-together, and I talked to you about our hospitalists who take care of our patients inside the hospital. These are doctors who are expert, and there are about 20 of them, and who practice strictly in the hospital. They do not have office practices, and they're very knowledgeable, and I'll often consult them for information and help with patients in general. Finally, let me move on over to electronic health records. This is an area of great interest to me. We started 3.5 years ago to have an electronic health record. Why? Why should we have an electronic health record? Have you ever tried to read a doctor's writing? Enough said. Well, this takes that away. No longer do I have to guess what is written, but we can also, when I write a prescription using this electronic health record, which happens to be Allscripts, which you can see on the left upper side there, Allscripts lets us know that we can write a prescription electronically, send it electronically to the pharmacy, and the pharmacist does not have to interpret our writing. In addition to that, if I write something that happens to be sensitive or the patient is allergic to, why, that'll prompt an alert to me and say, do you really want to prescribe that because the patient is allergic to that? Or it'll tell me about a drug-to-drug interaction and say, do you know that if you give that medication with that medication, they can have a negative effect on one another? This is a remarkable advancement for safety and for patient well-being, and has been fabulous for us. Now, we also have the ability, we now have nearly 150 doctors using the same Allscripts record. And if I send a patient to the gastroenterologist from the family doctor's office and they register with the gastroenterologist, he happens to use Allscripts, he'll be able to see every bit of the record. It does not have to be faxed or mailed. He has access to a shared enterprise record, remarkable. But we also have the ability to connect records that are not our own. We haven't done much of that lately, but we'll be able to bring alerts and notifications, customization messages to other electronic health records using our HIE called DB Motion. And that's really an exciting place we're going to. Finally, this is a patient-centered electronic health record. And what I mean by that, it's time for patients to take ownership of their records. And what we are doing right now, and where I spent last week learning about, is we're going to allow patients over the next year to two to access increasing information from their chart, access lab results, access imaging results, x-rays, CAT scans, and even access the progress notes that the doctors write on the patient. Now, don't get me wrong, there's a little pushback from some doctors about this, concerns expressed about, well, what if I write that? Well, you know, you need to learn not to write that way. You need to learn to write in a fashion that is intelligible and kind and respectful to everyone. And they're coming around because this is the future and the government is actually mandating this. I'll be happy to discuss any more details, but there's a lot to discuss here. Finally, I'd like to talk, and it looks like I'm going to make it. Finally, I'd like to talk about our future. We realize that there's a severe deficiency of primary care, family doctors, internal medicine doctors, pediatricians in this country, and we realize that we're not going to be in a very good situation if we don't start to grow our own. And that's what we're doing. As of last July, with the vision of Dr. Sam Small, our Director of Graduate Medical Education, we started at Community Memorial Health System 3 residencies, and here are our first residents. We got the pick of the litter nationally. For some reason, people were very attracted to coming here, and I know what some of those reasons are. And we have 4 internal medicine residents, we have 4 family practice residents, and 2 orthopedic residents. And starting in July, we're starting our general surgery residency. We will have 3 general surgical residents, 2 first years and 1 second year. Finally, this is a sample of the people who help our residents learn, who teach our residents, and that's the beauty. There's such a passion and fervor amongst the physicians to be involved in teaching. Some of the doctors said, you know, they'll slow me down. I don't want to get involved. I turn around a few weeks later, and they're ones who are most involved. Why? Because this is the nature of physicians. They want to pass their legacy, their experience, their knowledge on to the next generation, which is what makes us so wonderful to practice in Ventura. Thank you very much.
Thank you, Stan. Froxwag is a very common name, but Stan is very, very rare. We just love working with him, and it's a joy to work with him day after day. I'm going to continue just to give you an update on the health system now. We served last year well over 400,000 patients in our health system, and our health system is comprised of many more things than just the 2 hospitals. We have the Breast Care Center that's well accredited, the Prostate Institute of America, a continuing care center that's going to be remodeled, actually rebuilt in the future at our Ojai campus, the Keeter Center for Headache and Orofacial Pain, the San Buenaventura Urology Center. Stan mentioned the Wound Care Program, Grossman Imaging Centers, the Coastal Community Cancer Center, and the list goes on. We actually have about 30 buildings with our health system and serve the entire Western Ventura County. We have a women's center that we just opened last year, and we've received patient satisfaction scores. We have 100% excellent scores from all the patients there. That's remarkable, and it's a wonderful service. An all-female physician group. It's centered in Camarillo. We have decided to open up, this will become our 13th Center for Family Health, right at Leisure Village. It'll be opened in another few months to serve the need, particularly a growing aging population in that area. So we're very pleased about that. We could not do what we do without volunteers. We have 412 active volunteers who donate hundreds of hours, thousands of hours every year We feel so important about that our volunteer program is emphasized, and the president of the volunteers, the auxiliary, is a member of our board of trustees. We could not do what we do without our volunteers. Our employees, we have over 2,000 employees, and they are, we talk about our technology, we talk about the things that we're doing. We're very proud of our new hospitals we're building. It's the people. It's people like Stan, it's people like those pictured in this screen that make the difference. We just had nurses, a celebratory day yesterday, Nurses Day, and it was so wonderful to interact. When I came to the hospital, it's now just been just over, it's about 10 years and a week since I joined the staff. We decided to start a spiritual care program. And most of these individuals are volunteers, some are paid. But that's added an important dimension, particularly in areas of our palliative care program and our cancer program. We think this has been a real important added dimension. We have two foundations, one in the Ventura area, the Community Memorial Healthcare Foundation, and also the Ojai Valley Community Foundation. They have their separate board, they elect their officers, and their role is to do fundraising and also awareness raising for our community. I'll talk a little bit about what they're doing in community benefit. Our nursing program is unparalleled, and we have partners with Cal State Channel Islands, also Ventura College, where many of our employees have graduated. Some of our employees who are nurses' aides go back to school with scholarships and programs and become registered nurses. It's a fabulous program. One of the things we're proud of as well is we have a team of people now who go out and talk to patients to learn, really learn what we could do to improve. I round on patients every week, the senior managers do, and I hardly ever hear of a complaint, but I know that there are things that we could do better. This is a group of people who round, and patients share more readily things that we can do to improve, and our patient satisfaction as a result increases. Barbara Meister has been very generous with both her time and her means to support nursing programs and other areas of the hospital. She's had scholarships for the last, I think, about 10 years, and I don't remember how many nurses have now graduated because of the generosity of her. Barbara, you're here tonight, aren't you? Could you please stand? She's right in the front row, just to be acknowledged. She wouldn't want me to embarrass her, but I just did anyway. I'll apologize afterward, Barbara. We have a focus on quality. We're an organization that strives to seek out those things that we're not doing well and improve. In fact, just today we had a quality committee of our board of trustees, and we focus on this. We've created, we're very pleased with a lot of accolades. We're well accredited by Det Norska Veritas, and also have received the very coveted award of ISO 9001 certification. Those of you in manufacturing and other industries are aware of that, of how hard that is to achieve. About 5, maybe 10% of hospitals have received that designation annually. And we're also pleased that our outcomes, we compare ourselves with hundreds of other hospitals in the United States, and we're pleased that we score very favorably with the top 10%, the top decile of hospitals in our mortality rates, also in our efficiencies area, the top quartile, in our 30-day readmission rate, which is very, very low, among the lowest in the United States. At our Ojai campus, again, we've achieved the top decile of our mortality rates, and also 30-day readmission rate. Our patient satisfaction, wherever you see it green, it's better than not only the state average, but the national average for CMH, and also for Ojai. All those areas, we're doing extremely well in those areas. Our patient engagement program, though, attempts to find out what we could do. We look at statistics, and we are gratified to see that we're doing very well compared to national averages, but we have tried to instill a little bit of tension in our organization. where we identify individuals by name with their permission, usually just their first name, where we have done something that we could have avoided. In a couple cases, they've come to our board member meetings, they've come to our senior management group, and we're trying to learn and make it a little uncomfortable. And to make it uncomfortable means we're going to try to not ever do that again. And it's a little bit like what the airline industries have done over years to identify those things that could have been avoided because of simple human error, and then we try to never do that again. We're very pleased, thank you very much, that for year after year after year, we have been chosen as Ventura County's top hospital. And we put this slide up here because also our Ojai campus, CMH is the winner, but just like an honorable mention of favorite hospital, Ojai received that for the first time this year. We're very pleased about that. We have received Centers of Excellence designations for our women's health program, our mammography program. We have become a primary stroke receiving center, and our bariatric program has received a Center of Excellence designation. Now back to the foundations for a moment. Will Garand, who stood up a little while ago, he's sitting over here, is working with the community and our foundations to identify community need. In the Ventura community, we have surveyed, we've done focus groups, and we've learned that we need to do more in the areas that are listed here. I'm not going to take the time to go through them all, but these are things that in many ways are unmet needs. Things that we could be doing better, from preventing heart disease and diabetes all the way to behavioral health issues. And we have a similar list, a little bit different list in the Ojai Valley, substance abuse, prenatal care, and so forth, access to health care. And with the foundation, with the community, we're identifying things to do, and then we're going to invest resources, time, money to improve these situations for our community. One example of this is what we call our Health Aware program, where we have a staff that goes out to the community. It could be a business, it could be a Rotary Club, it could be a women's organization, whatever it might be. We would love to go out, it's free of charge, and identify what we can do to help. There are 7-minute assessments that you can do online in the privacy of your own home. We can also have our staff come out to do health screenings and to educate on what we can do to prevent heart disease, stroke, do better in weight, diabetes prevention, and Stan already mentioned lung assessment. This is something that's relatively new to identify early on. The cancer rates are not decreasing, but the survival rates are, and that is largely due to early detection. We also try to educate the community. We have a speakers series, and this is actually part of that. We've educated people everything from health reform to individual diseases. And if you'd like to get on the list, these are all free of charge. If you'd like to get on the list of these programs, please let us know, and we'll add you to the list so you can be aware of these speaker programs. We're very proud of our Cancer Resource Program. When a family member is diagnosed with cancer, it affects the entire family. We have a resource to support these families and the patients. Everything from art therapy, yoga therapy, we have a spiritual care aspect, we have an esthetician to help with makeup and cosmetics and hair pieces and so forth. And it's an excellent program. We have support services and support groups and caregiver groups to support during this time. It's an excellent service, and if you know of anybody who may not know about this program, a family member or a neighbor, please let them know about it. We have a Healthy Women's program. We have money set aside through our foundation to provide care for women who may not have adequate resources to have regular screening exams, or if they have a problem with cancer or similar things, we have money available to treat these, especially for women of modest means. And we want to get the word out that we have money available to treat patients. Now, I'm going to transition now to talk about our financial health. We don't have stockholders in our organization. We're a community, not-for-profit. We're the only independent, community-owned health system in our county. And so you are, in a sense, our stockholders, our stakeholders. Our balance sheet is strong and improving year by year. Our income statement, we're very pleased about this. Our rates, we're told by insurance plans, are among the lowest in the region. But we're a very efficient organization. We have no large corporate overhead. We were able to have an operating income of $32 million this last year, $20 million from operations. And then investment income, we have funds that we have very prudently invested to bring that money back to our community to apply. So we're very strong financially, among the strongest incomes without gouging the community. Again, our rates are among the lowest in the region, but we are very efficient and therefore profitable. Here's some of our statistics. Some of the fun ones that I like to see. We had 3 million prescriptions last year that we filled, 2 million pounds of laundry, 290,000 meals served, and you can look at the rest for yourself. But it's amazing for our organization. Look how many people have been affected. With outpatient visits, 128,000. Our Centers of Family Health that I mentioned saw 220,000 visits. And it's rare that I find someone in our community that has not been favorably touched. Our Ojai campus has a smaller balance sheet, and our income level there, we actually lost $1.7 million last year. We have just been designated as a critical access hospital that will help turn this around financially. And hopefully next year we will give you a report that we have a break-even status at our Ojai campus. And some statistics there, more modest, but for our Ojai area that has about 30,000 total residents, you can see that it's quite amazing. 7,800 emergency room visits. Without the health system, our Ojai campus could not survive. It's rare that a hospital is in a community the size of our Ojai community, and particularly for emergency services. We also have a policy that anybody who earns 350% or less of the federal poverty guideline will receive free care. And those above, we have a sliding scale. Last year, this is our cost, these are not charges, our actual costs of about $3 million for our health system that we provided. Now, the building. The need, of course, is that the state of California had an unfunded mandate that hospitals had to become very seismically secure and sound. But we also had outdated facilities, and we needed to upgrade our facilities to attract the new generation of physicians. So we're building a new hospital in Ventura, and we're modernizing the hospital in Ojai, and we'll also be replacing a skilled nursing facility in our Ojai community. So what we're doing beyond just becoming seismically strong, we have state-of-the-art operating rooms that we're building, a brand new emergency room, state-of-the-art critical care units. We're doing it in an environmentally pleasing way. We're going to go for the Gold LEED Award, if you're familiar with that engineering standard. Maternal child health, all on one floor. All the rooms will be private. And the rooms have been designed to be very family-centric. We have borrowed from a hospital that was built about a decade ago now, designed by the Disney Corporation, Celebration Hospital in Florida. So the rooms are beautifully designed. The windows are wall-to-wall, overlooking the islands or overlooking the mountains, and a family member will be able to overnight in the room very comfortably And we've really thought this through. This is arguably, the CMH hospital that we're building is arguably one of the best designed hospitals in the country, and we're very, very pleased about it. We also have healing gardens for patients and for our employees, and a lot of landscapes to gladden the heart and to beautify the surroundings. Last year when I spoke, this was the picture we showed you, okay? And now the steel is all up, and we celebrated breast cancer awareness where all the construction crew donned pink shirts, and we had a barbecue for them. They were great sports. But it's important that I note, from the very beginning, we have made a decision to hire local workers and to provide work for local workers and local contractors. When you drive around, you'll see a sign, Gary Wild harms the community or hates the community and so forth. And I regret that, but it's an out-of-area group that did work on the project for about 2 years. But we hired the contractor, the general contractor, hired a local contractor instead of one out of Arizona. We're putting our local people to work, and that was not agreeable to an outside group, and therefore the signs are up there. So when you see that, just wave politely. The people carrying the signs don't even know what the issues are, but we don't hate or harm the community. We're trying to do our best to provide work for our local workers. The building has gone up, and many of you have signed the beam, and we had a beam raising ceremony a few months ago. And we continue to go up, and we're doing internal framing now. It's interesting over here, we have this slide. You see these tubes right here. There's actually 3 where we have placed seismic probes down in the earth at various depths. So if there ever is a trembler in our area, these are directly connected to Caltech, and so they can determine how our building moved versus the soil underneath. And it just adds to the awareness of making the building more seismic proof. We've now started to put in a lot of the major equipment down in the basement. And this is a view right now. Somebody asked, is that the color of the building? No, this is just a waterproofing and insulating treatment around the outside. And that's the state of it right now. For those, we have a limited capacity to do this, but for those that would like to take a tour sometime, talk to us and we'll bring you through. You'll need to don a helmet and a vest, as these individuals are. But this is an asset that belongs to the community, and we'd love to share it with you. We've also determined that we need a new parking structure in addition to the existing one. While we have valet parking right now, we're going to have new parking, and it's going to look something like this. The new hospital, first of all, our existing hospital is right here. The existing parking structure right in that area. This is Brent Street, Main Street, and Loma Vista Street up here. So the new hospital is being built right here with a nice park in front. And we've decided to build a new parking structure right in this area here. There will be access points along Brent Street and also off of Main Street. This building is going to be taken down and a new little street's going to be put in here, so we'll be able to access the parking structure. And then it'll be a relatively short walk from the elevator of the parking structure into the front of the building. So we think this is a very nice addition. Here's what the new hospital will look like. We think it's an attractive building. It'll have sandstone from Santa Barbara for the first story, at least the first story, and the main part of it will be all the way up. And we're very excited. We're very pleased to bring this. It's an efficient design. It's a state-of-the-art building and a cost that we could afford, and we're very pleased to bring this to community. I want to now transition to our Ojai campus. We are modernizing this facility. We first had to do some seismic improvements and replace a roof and upgrade all the air conditioning systems. That project is all complete now. And we're now doing a renovation and also a modernization of our emitting area. And it's now going to look a lot more like Ojai than it did before. Here's a rendering, and here's what the construction looks like right now. It's actually further along than this. So next time you're on Maricopa Highway in Ojai, please look at it. It's just going to be a beautiful facility. We're also anticipating, we haven't gotten the cost estimates, and this has not been approved finally by our board or by the state, but we're anticipating a replacement continuing care center, a 60-bed skilled nursing facility at the Ojai campus that will conform in the architectural design, and it'll have a lot of the amenities that we currently can't provide for our patients in the continuing care center. So that's what we wanted to present to you tonight. I know we've talked for a long time. It's been an hour, and we try to cover a wide number of topics in a short period of time. One of our values is to be transparent, and I hope that we've done that. And we would be very honored to answer any questions you might have. If you have a private question, we'll stay up here afterward as well. So thank you very much. Does anyone have any questions? Please.
What's going to become of the old hospital?
The existing hospital, the question is what becomes of the old hospital? The existing hospital is about 50% of the space is going to be used just like it is right now. The laundry stays where it is, laboratory expands a little bit, conference room, administration stay where they are in the old building, nuclear medicine stays where it is, endoscopy and so forth. But floor by floor we have ideas and concepts of what we're going to do. One of the things we've talked about is we're now a teaching hospital, and so a lot of the space is going to be devoted to our physicians in training. And we'll have sleep rooms for that. We're considering having additional patient care services in the building, perhaps a rehabilitation component and expansion. We're considering physician offices, some incubator space for a biotechnical company to come, a fledgling company, and to be in a medical environment. And when they grow and develop, they'll sink roots right here in Ventura. So those are some of the ideas that we're going to do. Other questions, please? Yes, please.
Residency program start?
When did the residency program start? We've actually had an OBGYN residency program for, I think, about 6 years now, associated with UCLA. We've also had residents from Cottage Hospital and General Surgery. But we launched our own program in July of 2013. And it starts small, and it will be growing. We'll have every year, by definition, you have a little bit more than double the number of residents. And it'll eventually get up to a residency of about 60 to 70 physicians in training. Why are we doing this? We're doing this because about 1/3 of physicians now practicing are age 58 or older. And nationwide, there's a shortage projected of 125,000 by year 2020. So we're going to grow our own. And the best and brightest, we're going to replenish. So we always have a ready need. Although we are much better, because of where we live, we can recruit physicians more easily than if we were living in an area that was not beautiful and not wonderful weather. But we're going to do this to replenish our medical staff with the best and brightest. Okay? There's a couple more questions here I'll try to read. People need to know the rate of MRSA, E. coli, etc. How can you access this information? The best thing to do is to call our infection control person. Is Chris Willett here by chance? I don't see her. She actually presented, ironically, she presented our rates, which are lower, and they're expected to be lower in a setting like Ventura as opposed to an urban setting. But we have an infectious disease specialist and a committee that tracks this with antibiotic stewardship. Most of MRSA, as example, and even C. difficile and E. coli come in from outside the community to the hospital as opposed to somebody getting it. Our infection rates within the hospital, what we call nosocomial infection rates, are very, very low. That's one of the things we're very pleased about. But Chris Willett can answer the question. If you just call my number, whoever asks this question, come up afterward and I'll get you the contact information. The next one is explain Medigap insurance. Where do you purchase it, and generally, what is the cost? Medigap insurance is mostly a moniker for an augmented program for Medicare. Medicare itself, fee-for-service, pays for much of the hospitalization and so forth, but a Medicare patient has to pay a deductible of about $800 per year. Is that right, David, roughly? And also 20% of the outpatient care. Medigap insurance, and you can get them through AARP or Blue Cross, there's a number of programs that are available, pays that cost. So if you pay the premium, it pays a lot of the cost for the hospital deductible and your physician copay. I don't know if there's any insurance brokers present, what the monthly premium would be. I'm not aware of that. Does anybody know? I can put you in touch with somebody who might know. Please, do you know?
Well, just personal. I have an X plan from Blue Cross, and I pay $358 a month.
Okay. I was going to guess it was around a $300 figure, but that's what Medigap insurance is and what it's for. Okay? If there's no other questions, I just want to thank you so much for coming tonight. Both Stan and I will be up here afterward. We'd be delighted to answer any questions. Thank you so much for supporting Community Memorial Health System.